Hi, everyone, and thank you for joining us for this Facebook Live broadcast. I'm Allison Johnson, Manager of Communications at Windsor Regional Hospital, and today we're talking about the COVID vaccine. How does it work? When can you expect to get it? And we have a great team of experts here to talk about all of this. Please give a thumbs up to our panel this morning. We have Dr. Wasim Saad, Chief of Staff at Windsor Regional Hospital, Dr. Jessica Summerfield, family physician at Windsor Regional Hospital, a hospitalist and president of the Essex County Medical Society. We have Dr. Ian Mazzetti, Windsor Regional Hospital Chief of Medicine, internal medicine specialist, and an intensivist, and Dr. Jeff Cohen, Medical Director of the HIV Care Program at Windsor Regional Hospital and Rehab Program at Hotel Dieu Grace Healthcare. Hello, everyone. Good afternoon, actually. This is Coping with COVID, a series of live conversations about COVID-19. And if you have any questions today for our guests, please submit them in the comment section below so that we can address them during this discussion. We do have quite a few questions that were sent to us in advance. So thank you all of those of you who sent, and we'll try to get to as many as possible this morning. But first, I want to share with you a video. And we haven't had a lot of positive news lately. The region, the highest COVID rates, infections in the province, and despite the lockdown, record numbers are still being seen. We're seeing devastating outbreaks in facilities across the region. And then yesterday, some good news. The vaccine is here, albeit a limited supply, but that is a huge step in the right direction. And I want to introduce you right now to Crystal Malash. She's a personal support worker from Seasons Bell River and the very first person in the region to get vaccinated. Here she is yesterday after receiving her shot.
I'm very overwhelmed, to be honest with you. I'm very honored. It was quite the journey this year for myself and my family as far as COVID-19. And to be one of the first to be vaccinated against this is, it's an honor. It really is, for many reasons. Not only as a frontline worker, but as somebody who COVID has affected my life and my family, and it took my father, you know, and to give myself the extra protection against it, I'm very honored right now. I came into our house May 16th, and we lost him June 19th. I want people to know that if you can take the steps to take the extra precautions to protect yourself, your family, do it. We've had the last however many months of not knowing what to do, what's going to happen. And I'm sure there's still a lot of unknowns with this. But at the same time, if we have the option to protect ourselves, do it, people. Because this is not going away. And if you can see what it does to people, take the extra step to protect yourself.
Crystal Malash, Seasons of Bell River, thank you for stepping up and going first. Who doesn't have goosebumps after hearing that? To our panel, you have been at the forefront of the response to this from the beginning. As the virus hits our community, you've seen the impact and the toll that it takes. What was your reaction yesterday after the first dose was administered? Dr. Saad, let's start with you.
I can tell you, because I was there on site when the first dose was administered, and not something you would expect from somebody getting a vaccine, but everybody burst into cheers and laughter and started clapping. There was applause. It was, you could feel goosebumps while you were there. Obviously media was there, they were taking pictures, but just looking at her, knowing her story in the background and what she had to go through to get to that point, and then volunteering to be the first person in Windsor, Essex to receive the vaccine locally, I was proud to be part of that moment.
Wonderful. Dr. Mazzetti, over to you. How did you react to the news this week?
So if I could jump up and cheer Allison on this podcast or this live cast, I would. As someone who works in acute care and critical care, certainly we've seen the devastating effects of this condition. And I think, this vaccination program, it provides a light at the end of the tunnel for those of us in healthcare, for the whole community. So it's a really exciting time for Windsor, Essex.
Absolutely. Dr. Cohen?
You're muted, Jeff. Sorry, you're muted.
Dr. Summerfield, do you want to hop in and we'll fix Dr. Cohen's mic?
Absolutely. So similar to my colleagues, I was overwhelmingly excited. I can't remember the last time I've been this excited about something. But really the reason, the main reason I went into family medicine was exactly that, prevention of disease. And that's what vaccination is all about. So it's a very exciting time for us.
Dr. Cohen, we'll let you speak now.
Yeah. Well, I listen, the vaccine has been proven in trials to be very safe. And we've already had, I think, 1 million or 2 doses around the world, and really no serious reactions as expected from the trials. But for me, it's this. That's what I was thinking. I just hope this thing works. I hope that the immunity that it provides lasts for a long time. I hope that it provides protection against variants of the virus. So, I'm happy and I'm pleased that we have the vaccines, but I still, thinking scientifically, there's so many unanswered questions, so many unknowns, that we're all in this adventure together. It's actually not much of an adventure, but we're all in this together, and we'll all see what happens over the next period of time.
But I like the message of hope, something we haven't talked much about recently. Now, Dr. Summerfield, it was your idea to have this conversation today. You wanted to make sure that the community had a chance to talk about this vaccination and ask questions. Why was that important to you?
Thanks, Allison. And I appreciate all my colleagues joining me today. I think it's a very important discussion to be had. I was hearing a lot of conversations in the community about hesitation regarding the vaccination, a lot of unanswered questions. So I thought it was a great opportunity to really hit it at the front and provide some really top quality evidence that we do currently have. Yes, there are still a lot of unknowns, but there is still a lot that we do know that we can say confidently, that I'm happy to provide, and really encouraging people to get the vaccine so we can protect our community was really the goal.
So let's start from the beginning. Dr. Saad, what do we know about this vaccination? What is it made of and how does it work?
So good question. The first vaccine that we have is the Pfizer-BioNTech vaccine, which is what we call an mRNA vaccine. This is one of the first vaccines in this category to be approved ever, which is very exciting. And we just learned earlier today that the Moderna vaccine has been approved by Health Canada as well. So now we will have 2 vaccines from 2 different companies that work in very similar ways. And what it does is, it provides a piece of mRNA, which is a piece of genetic material that the body then uses to make something that's very similar to the spike protein that's on the coronavirus. And so in a lot of traditional vaccines, what they do is they either destroy the virus and then give it to you because it can't give you infection, or they weaken it, or they just give you one piece of the protein that they want your body to develop immunity against. In this case, the body receives instructions to make that protein from the coronavirus. So you can't possibly become infected with coronavirus because you're not getting the full virus, you're being exposed to just one part of it. And then your body develops an immune response to it, so that when you are exposed to the actual virus, your immune system is ready to go. From a technical perspective, the Pfizer vaccine right now, it has a lot of limitations in how it can be stored and used and how many times it can move. Right now, we have set up at the St. Clair Center for this vaccine, we have to buy a special fridge that will, a freezer that will go down to minus 80 degrees where it's stored. And that's all it can be moved. We can't move it anywhere else, which means for this vaccine in particular, we have to bring people to the vaccine in order to be vaccinated. Whereas with others that don't require such extreme temperatures for storage, you're able to take the vaccine to people, to primary care, to the hospital, to their homes, wherever, if you need to. So that's what's unique about this vaccine. And there are certain, almost anybody can get it. Right now for this vaccine, it's age more than 18. With Moderna, it's age greater than 16. The contraindications are pregnant patients, patients who are currently breastfeeding, and anyone who's had a quote unquote serious allergic reaction, meaning anaphylaxis in the past or carry around an EpiPen. But otherwise, it's, again, most people will be able to get it. Right now, we're restricted in how people have to go to the Pfizer vaccine because of those limitations. But there are others that are, again, near completing their phase 3 trials, are hoping to get approval soon in phase 3, and then we'll have a big arsenal to use in terms of vaccines.
Dr. Mazzetti, we had a lot of questions about what to expect after somebody gets this vaccination. So what happens? You get the vaccination. What happens after that? How long does it take to become effective? And then what side effects can you possibly expect and when?
Yeah, so as Dr. Saad explained, you know, the vaccine is taken up by the body. There are a type of sentinel cells of your immune system that take it up. They make this protein that looks like the spike protein, and then the body recognizes this and it starts to develop antibodies against that. And so the process of the body recognizing this as foreign, it can lead to, sometimes people will get low-grade temperature, sometimes they'll get aches, particularly in the area where they get their vaccine, very similar to some of the mild side effects that other vaccines like the flu vaccine or pneumococcal vaccine might cause. The mRNA it's unstable. It doesn't stay in the body for very long. You know, after 4 or 5 days, it's out of the system. So, you know, you don't have to worry about prolonged effects that way. So I think the incidence of severe side effects was vanishingly low in the big study that looked at just over 40,000 people. And of course, the makers of the vaccine in Health Canada are collecting information as we see it being used in the real world.
So you mentioned their mRNA, and we did have a question, this one to Dr. Cohen. What is the difference between mRNA and the regular attenuated virus? And is one better than the other?
Well, as Dr. Saad mentioned, the usual vaccines that everyone has received, for example, the MMR for measles or the chickenpox vaccine, these are live attenuated viruses. These are actually viruses that can infect cells in our body, but they've sort of like you can breed different pets with different characteristics. They breed this virus to not be terribly lethal or to make you sick. But they have enough of the original virus on them that they stimulate the immune response. So when the dangerous virus ends up in your body, you have the protection against it. And the power of these vaccines, because they do provide pretty well lifelong immunity, for example, chickenpox, measles, mumps, rubella. The power of those is they actually get in and they actually stimulate the full immune response, not just antibodies, but T cells and other aspects of the immune system. So they provide tremendous immunity. And that's their main advantage, but they're very hard to make. They have to have specialized manufacturing facilities. You have to grow the virus, and it takes a lot of effort, and it's a very expensive process. With the mRNA viruses, you actually are, it's not so much that it's taken up. These particles that are coated in fat and just have the blueprint for the spike protein on them, they actually hijack the cell's machinery to make copies of this protein. So it's really hijacking your own cell machinery. But the fear that people are saying that, well, you know, these mRNA viruses are going to get incorporated into our genes. This messenger RNA does not enter the cell's nucleus, does not go anywhere near a chromosome, and cannot become part of your own genetic makeup. They actually only last for less than a day before they're degraded. These are very unstable molecules. That's why you have to have them frozen, why they require specialized techniques. So this is just a naked piece of RNA that has no other effect on the body other than hijacking the machinery to make this protein.
It is pretty fascinating, but then you do hear that question a lot, is this virus going to alter my DNA? And that is one of the big concerns, so
no.
not a concern.
No.
All right, Dr. Summerfield, there were prioritized groups that are now starting to receive this vaccination, long-term care and retirement homes among them. A question to you, how were those groups selected to go first?
I think Dr. Saad could also back me up on this, but this was really directed from a provincial level. So we didn't have a say as to who was delegated as the initial group. I think that's an important thing for local people to understand. This came from a provincial level. And really it's a point of understanding privilege and value of contribution to the healthcare system. So the people that were designated to go first are highly valued members of the healthcare team that we need them. And if they become infected, they're very difficult to replace in the healthcare field. So I was hearing language around the idea that we don't want to be guinea pigs, why are they sending us to go first? Quite the contrary. So, I mean, I would be happy to be the first one in line, but, the PSW workers in long-term care are actually more valuable than what I have to currently offer. So changing the conversation with that in mind, I think is really important. And Dr. Sad, if you want anything further to add to that.
You're absolutely right. This was not a local decision. This was actually more federal than anything. And then the ministry itself was dictating what the highest risk people are for contracting COVID and who should be prioritized. If you look at other countries, some other countries chose their frontline workers, their ER workers, their ICU workers to go first. Canada and other countries similar to Canada have chosen long-term care facilities because we know that once the virus is in long-term care homes, we know what kind of devastating effect it's had during wave 1, what kind of effect it's having in wave 2, and protecting the healthcare workers that provide care to those long-term care facilities, followed by the long-term care residents themselves, was a priority for Canada and the province of Ontario, and that's why those are being rolled out first.
We did actually have a lot of questions from people asking about the order and when will I be able to get mine. Well, you have the people who are concerned and maybe hesitant. A lot of people wondering when do I get to be in that line. So Dr. Saad, a question to you. Will private home care providers be included in the prioritized groups identified for receiving the vaccine? And this individual goes on to say that we have many staff in the community and the long-term care retirement facilities working with seniors and vulnerable populations. We work alongside with the LHIN-funded providers in many instances. When will we be up and how will we be informed?
Yeah, so you will be up first. You're in that initial group that as long as you're tied to a long-term care facility, whether you are there on the ground or providing ancillary services related to it, that's the priority group that is up first. Now, having said that, the other thing that we're doing is making sure that we don't vaccinate 100% of everyone all at the same time. So it's being rolled out slowly, and that's more to mitigate risk and safety just in case there are reactions. So if, for example, we start vaccinating our ICU staff, we're not going to vaccinate 100% of our ICU staff in case there's a reaction and then we can't run our ICU. So similarly with the long-term care facilities, it's being done, so about a third, 35% is being done first, then the other 35%, and then the final 30%. So if you have not heard yet, then you may not be in that first 35%, but the homes themselves are making the decisions. They're in terms of the staff. They are contacting the staff directly, giving them appointments, and so this person who asked that question, yes, you are in that first group, and you will get a call from the home telling you when you're ready to go.
And we had a lot of other questions from people at home, seniors at home, wondering when will it be my turn, and how will I find out?
So again, patience is the key here because if we had all of the vaccine supply available to us right now, it would still take a monumental effort to get everyone in Ontario vaccinated. I'm sure everybody can understand what a huge undertaking this is. But because we're getting the supply slowly, right now we have less than 2,000 people that could be vaccinated with the current supply that we have. By the time the long-term care facilities are done, both residents and staff, and then we get into the healthcare sector, we're probably looking at close to the spring of 2021. So first quarter 2021. From there, it'll be that population that you just mentioned, Allison, people who are older, people with comorbidities, because that's the next age group. And that's probably going to be closer to the middle of the year next year. How will they find out? There will be a lot of public messaging going out, a lot of media. If you'll have to be living under a rock not to get it and know when it's your turn. And there will be outreach programs to make sure that people are aware that it's their time to come get vaccinated.
Absolutely. A lot of people looking forward to getting that call for sure. To Dr. Mazzetti, with the number of variants of SARS-CoV virus now identified globally and with varying infectious properties, is it likely that a new vaccine will need to be formulated every year, such as done with the flu vaccine?
So that's a very good question. And, as we're learning more about COVID-19 and the various vaccines, unfortunately, the answer is, at this point, we really don't know. There's some talk about a new variant that was seen overseas, and there are studies ongoing with Pfizer to see if the current vaccine is going to be effective with that. They believe it will be. But, really, as with a lot of this new information that's coming out, only time will tell. I think it's a reasonable proposition, but at this point we don't know. In fact, we don't know at this point how long immunity from this particular vaccine, the vaccine that people are getting now, how long that immunity will last. So stay tuned for that information. But it's a very good question.
And Allison, if I can add to what Dr. Mazzetti is saying, one of the things that we're trying to accomplish with this is to be completely open and transparent. If there's something that we know, we're going to tell you that we know it. And if there's something we don't know, as Dr. Mazzetti just did, we are going to tell you we don't know. And it's not because we're not researching or the knowledge is not out there. Nobody in the world knows, because this is such a new vaccine, and we haven't even looked at it and studied it long enough. So just so people know, we may not have all the answers, but we are going to tell you what we do know and what we don't.
Absolutely. And that's why we have these conversations like we talked about right from the beginning. The information is changing so quickly. We like to have these conversations as an opportunity to get that information out when we have it. And you mentioned we were talking a couple weeks ago, talking about the research out there, and so much has changed even in just that couple of weeks. So appreciate, again, all of your time. Another question to Dr. Saad. What is the length of time for immunity once someone is vaccinated?
I'm going to start off with, we don't know. So the bare minimum that we do know is from the clinical trials and what's been done so far. So I can tell you that for sure immunity will last at least 14 weeks. And that's all I can really tell you. Now, having said that, we do know from other vaccines and the immune system response, and from people who've had natural infections with COVID, that immunity likely lasts anywhere from 6 to 9 months, at least we know from natural immunity. But beyond that, I can't answer that, because obviously we haven't had enough time or experience with this vaccine. It's possible that this vaccine could provide a year, 2 years, maybe lifelong immunity, although it makes it less likely. Because again, we're targeting one single protein, and there's the possibility of mutations, and the immune system is quite complex. But as in general, I think a safe estimate would be 6 to 9 months, maybe up to 12 months. But beyond that, I really can't say, because we don't know.
We are getting a lot of questions coming in with people asking questions about specifically who can and who should maybe not receive the vaccination. Dr. Cohen, one for you. Can someone on blood thinners or who has had cancer receive the vaccination?
Yes, they can. I think the easiest way to divide it up and to keep it simple is to look at two categories. One is people who have allergies, and then people who have certain medical conditions. So really, according to the CDC website on the vaccines, that is currently interim because we don't have as much knowledge as we'd like, the only absolute reason never to get the vaccine is if you've had an allergic reaction to an mRNA vaccine. Considering that these are the only two in the world that have ever existed, it sort of means that if you have a reaction to the first shot, you're not getting the second shot. An allergic reaction, anaphylactic reaction, a severe allergic reaction. There's been some stuff in the press about people who have food allergies, nut allergies, all those types of things. Those people can receive the vaccine. They just need to be monitored for a little period longer after they have the shot, and hopefully in a facility where they have EpiPens or whatever to reverse the reaction. People who've had a serious allergic reaction to another vaccine or to any injectable medicine need to be watched very closely, and certainly in a facility where they can handle an anaphylactic reaction. But if that person is at high risk for COVID, they probably should get the vaccine. So the only real reason never, the red flag, is if you've had a reaction to an mRNA vaccine. But as far as medical conditions are concerned, whether it's cancer, immunocompromised conditions, autoimmune disease, even pregnancy and lactation, these are not absolute contraindications to receiving the vaccine. The problem is that the clinical trials didn't look at enough of people with those conditions. But remember, we're not giving someone who's immunocompromised, for example, a live virus. We're giving them a piece of RNA. It really should have no impact on their health in the sense of escaping their immune system and causing terrible disease. We're not giving the coronavirus in these vaccines. We're giving a little piece of messenger RNA that produces a protein. There is no actual infection. So people with immunocompromise, pregnant women, etc., there is no absolute contraindication to them getting the vaccine. They have to sit down and have a decent discussion with their physician or their healthcare provider based on the lack of direct knowledge. But looking at basic principles, those people, if they need the vaccine, should get it.
think you covered a lot of ground there and answered a lot of the questions, but and then, like you said, if you still have further questions, have that conversation with your primary care provider. One of the ones that that I didn't hear though, somebody would like to know, are there any vaccinations for children coming? Dr. Mazzetti?
Yeah, so we heard, I think, from Dr. Saad earlier that the Pfizer vaccine, if memory serves, looked at folks 18 and above, and Moderna looks at folks 16 and above. I mean, clearly, the initial studies want to make sure that it's safe in adults. We know that children's immune systems can work somewhat differently. And so once these vaccines, they've been shown to be safe, once we show with, post-marketing surveillance that they're safe, we expect that that data will start to become available in children, but that data, to my knowledge, and other members can correct me if I'm wrong, I don't believe that knowledge is yet available. So time will tell.
And a follow-up, if someone is on a ventilator and has not had any of the antibody treatment, can the vaccine help them?
So when someone's very sick on a ventilator, the immune system is not working the way it would as if they were out in the community and well. And so the vaccine, when someone is sick on the ventilator with COVID, that's not the time to be giving someone the vaccination. In fact, active infection with COVID is not the circumstance in which you'd want to be vaccinating someone.
All right. And a question for Dr. Saad. I know that you already did address this, but we're still getting questions coming in. So maybe we can just repeat. Someone wants to know, how do we as PSWs get the vaccine? And another wants to know, how will I be contacted? So if we can just cover that ground again.
Yeah, so again, my understanding is that the homes are reaching out to their staff. This is obviously a voluntary basis. So if you have volunteered or consented to have the vaccine, then the homes will book the staff into our system and then contact you with an appointment. If you have not been contacted, then obviously reach out to your administrators and say, I'm interested in getting the vaccine. I want to get the vaccine, put me in the queue. And as I said, it's not going to be everybody all at once. So they're doing them in sort of a thirds. But eventually everybody will get vaccinated who wants to get vaccinated. So please reach out to whoever your manager or director is, or some, the administrator or owner of your home, and let them know that you want to get the vaccine. You will get the vaccine. You can't book it yourselves. We're booking through the homes. They're the ones that are booking the appointments for you at the hospital or at the St. Clair.
To Dr. Summerfield, is there a hotline for individuals to call after they receive the vaccine if they have any questions about any side effects that they're experiencing, and especially once the general population begins receiving the vaccine, so that everybody isn't rushing to the emergency departments, not understanding what their experience is, what someone is asking here.
Yeah, absolutely. So this is a great opportunity to reach out to your family doctor, assuming that these reactions are mild in nature if they have questions. And there's always Telehealth Ontario as well that people can reach out to. I think by the time the general population receives the vaccine, we'll have been talking about this for so long that people's anxiety level and just apprehension and just overall psychological reaction to it will be hopefully much lower. So there'll be a lot less panic involved with receiving the vaccination. Otherwise, we haven't done our job, and these are early conversations, but that's definitely the goal.
So it was great to hear from Crystal Malash and others like her yesterday after receiving the vaccine, how excited they were. And we heard other people say, it didn't hurt, and they're going to tell everybody to get it. So it's great to hear from them. Dr. Cohen, we've heard about the mutating vaccine, or the mutating virus overseas. Somebody wants to know, has the new variant been identified in Windsor, and what makes this variant more contagious?
Well, it hasn't even been identified in North America. Wasim and I were talking about this earlier. Anthony Fauci in the States says it's probably here, but we've never tested for it because there really is no, at this point, resources haven't been directed at really analyzing the virus in great detail the same way they did in Britain. Look, the virus started off in bats and made its way into humans. It was initially not a human virus. In order to be efficiently reproducing in our bodies, it has to mutate. So it's no surprise that there's mutations of the virus from when it first got into humans. As it learns more and more about how humans work, it adapts to humans and more mutations will accumulate. So for example, one of the mutations that, well, the one that's in Britain now has about 17 or 18 mutations in the virus that seem to have an impact. One of them has been around since the beginning of time. We have that here, the 162 mutation. But what these mutations do is they change some of the structures of the virus. So for example, they can latch onto cells a little more efficiently, hold on more tightly, release their contents into the cell. Other ones become more adept at getting through our initial defenses, say the lining of your nose or the lining of your eyes to get into your body. So transmissibility increases, but at this point it does not look like the virulence of the virus has increased. The number of people actually getting sick from it, they're not any sicker than with the other strains of virus we're more familiar with. That's always, I guess the word would be a crapshoot. You never know when a virus is going to take a nasty turn. But right now what the virus is doing is just adapting to humans. And it doesn't take much for it to do that, a few mutations here and there, but it looks like the types of mutations so far are not affecting the targets of the vaccines that we have at this point. So again, I'm optimistic that these vaccines will continue to work unless some sort of strange mutation occurs, which with viruses you can never be sure of.
I would echo Dr. Cohen's thoughts on that as well. The virus is behaving exactly how we expect viruses to behave. They do mutate. All viruses mutate. When I hear conversations around, well, it's already mutating, so what's the point of getting the vaccine? It's very important for people to understand we are already expecting it to mutate. People are actively watching this day by day. Most mutations that viruses make actually do nothing. So it's not a thought that, oh, the longer this rolls out, the less effective the vaccine will be. That's not the case. To think that these mutations that happen very subtly over time will undermine a vaccine that's 95% effective is really the wrong way of thinking about it. So I think that's important for people to understand.
But it still underscores the importance of the non-vaccine methods of preventing transmission. I mean, masks, social distancing, hand washing, limited congregation of people. These are the things that will shut the virus down and give us a chance to actually get the vaccines into people. And if those vaccines are only partially effective, allow scientists to create even more effective vaccines. We've already seen with the RNA virus vaccines how rapidly the technology was able to develop the vaccine. Most vaccines take 5 to 10 years to come to market. This is 9 months after 9 to 10 months after the Chinese released the actual genetic sequence of the virus that we have vaccines created on platforms. And they'll create new platforms when they get the genetics of the new viruses and modify the vaccines very rapidly and very efficiently. The system is set up to move really quickly. This is a rapid defense force that is out there to protect us. So that part of I'm optimistic. The knowledge gaps make me nervous, but I'm optimistic about the ability of the scientists to come up with effective vaccines in a rapid manner, even if the virus does mutate in a way that makes the current vaccines not as effective as we'd like them to be.
And a follow-up question to what you had been mentioning earlier in terms of who can and should receive the vaccination. If someone is allergic to flu shots, like hives or a rash, not anaphylactic, is the vaccine safe?
Well, we don't really know that for sure. You can't answer every question with a trial of 100,000 people or 50,000 people, but the CDC recommends that people who have those minor reactions be counseled, and if they really need the vaccine, if they're in a high-risk group, for example, in this initial phase of rollout, then they should be in a facility where they could get a shot of adrenaline if they have an allergic reaction. I mean, we can reverse the allergic reaction and we can manage it medically. There should be nobody dying of that allergic reaction if they're in the proper medical facility. So yes, people with reactions to flu shots can certainly get the vaccine.
Dr. Saad, a question: what would happen if you were to contact COVID-19 and become symptomatic in between vaccines number 1 and number 2? Would vaccine number 2 have to be delayed, or would you have to start over then?
Good question. I can tell you that immunity from the vaccines will begin a few days to a week after the first dose, and maximum immunity will be achieved about a week after your second dose. So yes, it is very possible that after you get the first dose, you can acquire a natural infection. It's even possible after you get both doses, right? They're not 100% effective, so there's a small chance, but that also is possible. In that case, if you have an active infection, as Dr. Mazzetti mentioned earlier, it's recommended that you don't receive the vaccine while you have an active infection. So that second dose will definitely have to be postponed. We don't have any evidence right now that suggests that you have to restart the series all over again. So once you're well enough and have recovered, you can take your second dose, which is the booster dose, without having to restart the series. And that would apply for any other type of infection. So if you get a bad cold or pneumonia or something non-COVID related, you postpone that second dose until you're well enough to take it.
Is there a period of time in between those two doses where it would expire or become ineffective?
Again, we don't know the exact answer to that, but if it holds true to any of the other vaccine series where it takes 2 or 3 doses where you require a booster, you generally don't have to restart the series. The first dose triggers the immune system. The second one is meant to boost it up. So even if there's a delay, it's okay that there's a delay. Not ideal, obviously, but better than nothing.
To Dr. Summerfield, what is the most serious side effect in regard to receiving the vaccine?
I think we touched on that, and that's the anaphylactic reaction. We know how to treat anaphylaxis, so that's optimistic. Treatment for COVID is life-threatening as well. So,
and a question about, we may have covered this one as well. If you have had COVID, should you wait a certain amount of time before getting the vaccine? Dr. Mazzetti?
Yeah, so there's not great data for this. I mean, obviously you'd want to wait until the symptoms have cleared, wait until, you're back to your usual state of health. Certainly having had COVID-19 is not a contraindication to getting the vaccination at some point in the future. And so I think, depending on how things roll out over the next months to years, I think there will be opportunity. Our government has committed that anyone who wants it, who is a candidate for the vaccine, will be able to get it. And this includes folks who have had COVID-19, right? Realistically, guys, there's going to be a lot of us, as this pandemic goes on. But certainly it's safe to get after you've had COVID.
And to Dr. Cohen, is it possible for someone to receive the vaccine but still get COVID?
Of course. I mean, no vaccine is 100%. Not too much in medicine is 100%, no matter what you're doing. Yes, sure, certainly it is. And, right now it looks like, as Dr. Sad was pointing out, it looks like the antibodies and the immune response to the vaccine certainly lasts at least 90 days. And the interesting thing in a recent paper was that those levels of protection at 90 days are actually higher than the levels of protection against the virus that are acquired through being infected. So the vaccine seems to have a little bit of an edge at 90 days. The trouble is that it's sort of like a downward curve. It's very strong at the beginning and it's slowly waning. It's still above what would happen if you had a natural infection, but nobody knows what's going to happen in the next few months. So whether the vaccine will have, effective protection for that period of time is not clear.
And I think if I may add something, it just highlights the importance of following all of the public health measures, social distancing, masking where appropriate, hand washing. These are simple things that everyone can do. We all have a role to play in this.
And we started the conversation today by hearing from Crystal LaRocque, the first individual to be vaccinated. I want to bring another voice into the conversation now as we're starting to wrap up. This is Edith LaRocque, and she is a nurse at Amica Riverside.
I'm feeling great. I am overwhelmed with emotion. This is the best gift that you can give yourself and anybody that you have contact with. It's just, I feel like I'm going to cry. It's just so emotional. I feel great. It didn't hurt. So don't believe anything that you hear. It did not hurt. I've been a nurse at Amica Riverside for 10 years since it had opened. And we went into outbreak, and then we worked long hours and whatnot, trying to get a hold on it. Well, I ended up, maybe about a month later, I got COVID, And then my husband got COVID, but we would already, while I was working there, we already separated. But it's just COVID, such a highly, highly contagious thing. People have no idea. It's just no idea. I just hope that everybody realizes the importance of getting it. You know, there's a lot of people thinking that it's something, that it's a nothing deal, but you have no idea how your body is going to react to COVID. You know, some people do get the mild cases, but there's other people that suffer or they lose their lives, and it's just not a gamble that I feel that anybody should take.
Thanks, Edith, for again stepping in and being first in line to receive the vaccination and for that important message. And we are just 2 days away from what's going to be a pretty difficult Christmas for many people, but also a new year that holds a lot of promise. And before we say goodbye to everyone today, I want to give each of you a chance to share any last message for those joining us today before we sign off this webcast for 2020. And Dr. Summerfield, let's start with you.
Thank you, everyone, for joining us. I hope that this was effective and thought-provoking, if nothing more. I know there were a lot of questions about pregnancy and the vaccine, so I think just to point to that, it's not currently recommended for pregnancy, but stay tuned on that because it's definitely a high-risk population, and the only reason for that is because they were excluded from the trial. So there will be more information coming in relation to pregnancy and the vaccine. So thanks everyone for joining. I think it was a great conversation. Thanks for your questions.
Thank you, Dr. Summerfield. Dr. Mazzetti?
I'd just like to echo Dr. Summerfield's thanks, to Windsor Regional Public Affairs. Allison, thank you for inviting us. Thanks to my colleagues and everyone who's tuned in. And, thanks to the community. We all recognize life is very different than it was last Christmas. And we all recognize, I think, the sacrifices that everyone has had to make. And I think this vaccination, it contributes to the end of this pandemic. And I implore everyone to stay safe. Let's follow the guidelines that we've been given. And part of this vaccination strategy, it's going to bring us to the end of that tunnel. So thank you all.
Thank you, Dr. Mazzetti. Dr. Cohen?
Again, thanks everybody for participating. I hope it was useful to the public. Look, we all got to hang in there. This is not over. The vaccine is just rolling out. There are many unanswered questions, and you have to stay safe, and you have to stay safe for a long time. This is not going to be over probably until next summer at the earliest, that we're going to be able to get back to our normal lives. So as hard as it is, we need to hunker down and do the things that are needed to do to protect ourselves, our loved ones, our community, and essentially the whole world, where well over 1.5 million people have already died of this virus in just 9 months. So hang in there, and I have great faith in the science.
Thanks, Dr. Cohen. Over to you, Dr. Saad, for the last word.
Thank you. Thank you to Jessica, who thought of doing this to help everyone who's rolling out the vaccines, who may have had anxiety. Hopefully we were able to provide some answers for you, especially the answers that we knew, and take solace in knowing that the ones that we don't know, at least we have a good idea based on science. As has been mentioned, this is the beginning of the end. It's not going to be a quick end. It's going to be a long end, just like the beginning was, and it will take several months, but we are going to get there. The only way that this pandemic is going to end is with the vaccine and with mass vaccination programs. And it's here. It's upon us. It's in Windsor. We're starting to do it. So while that happens, we should continue to be safe, as everyone's mentioned. I do see a light at the end of the tunnel. It gives me a lot of hope that we are at the end, and this is the beginning of the end. So hopefully, as the next few seminars go, we'll keep giving positive updates, and then this will all be behind us by the end of 2021.
Sounds good. Thank you, and thanks to our entire panel for all of your time today. I know that throughout this, you have all been very busy, and we truly do appreciate your time and being part of this conversation. Thanks to all of you who joined and everyone who sent us questions. Please stay safe, please stay home, and come back and see us in the new year. And last but certainly not least, a huge thank you to all of the frontline workers who will be working over the holiday season, many working overtime because resources are stressed. And thank you for caring for our families and our friends and our neighbors when we can't be there. Cheers, everyone.